You're a medical provider here. How was working with us with Foodmapping different than anything you've done as a patient or as a healthcare provider?
The thing that was really interesting was that to see that it was personalized to me. I had been trying, I had been recommended all these elimination diets that generally just left me crying because I felt like I couldn't eat anything. It was just eliminating even more foods. Other healthcare providers would just say, oh, just drink an Ensure. Drink an Ensure. That'll just cover everything.
I'm Maggie Yu MD, functional and holistic medicine physician and owner of Transform, and I have two alumni with me. And today, it's our autoimmune table talk, and I love the topic around headache and migraines because it is such a common symptom in any autoimmune disease or not. And so I'd love, Christina, Merritt, for you guys to introduce yourselves.
Thanks for having me. I joined your program 3 years ago, and I had lupus since I was about 16. Well, I was diagnosed when I was 16, but it had symptoms since I was 12. Over the years, I collected a variety of diagnoses to include Sjogren syndrome, gastroparesis, dysautonomia, and I pretty much lived with daily headaches that I had given up complaining to doctors about. But in the few months before I came to your program, they were getting considerably worse and affecting how I could function every day.
On a scale of 0 to 10, 10 being the worst for the symptom, is how bad were your headaches and migraines?
I would say that on any given day, I had a level 1, 2 headache at least. And I mean, it was pretty standard. I remember when I was working, I would get to work and I would pop anywhere between 600 to 800 milligrams of ibuprofen and down a diet Dr. Pepper. And that's how I got through the day.
How many of you out there are actually doing this thing with the headaches where you're basically either coffee or diet Dr. Peppering it on a daily basis to just deal with those symptoms, only to have these headaches come back over and over again? I'd love to hear it in the comment section. So that was you, Christina.
Yes. And then I would say in the months before I joined your program, as the symptoms of dysautonomia or POTS had started to pop up, I had gotten to the point that if I had any kind of exertion, I would end up with a pounding headache that would last 3 to 4 days to the point I couldn't function. By that point, I had also discovered that I had chronic duodenitis from the chronic ibuprofen use. And I was on Plaquenil. Tylenol is contraindicated when you're on Plaquenil. So I was getting to the point I was having, I would say they were levels between 6 and 8 when they would get to that point, and I felt like I had no options for pain relief.
Well, I mean, Christina, you actually highlighted a typical case where you got these migraines, and yet the very medications you're told to take it is actually causing serious side effects and additional health new diagnoses.
Right.
Yeah.
And they weren't even working that great anyway.
Right.
So I have had headaches back from as far back as I can remember. I was the kiddo that had eczema and headaches, and that was my thing. And I can remember being, even 7, 8, 9 years old, laying on the sofa and not being able to get up. And, as a kid, you want to be up and moving around. So as I got older, as I moved through puberty, period hits, and then all of a sudden I found myself getting monthly migraines, and to the point where, and especially after I had my second son, they had gotten so bad that I would be at work and just know that, okay, it's Wednesday and I know I'm going to end up with this migraine, and by 10 o'clock I was popping 2 Excedrin and the caffeine, and otherwise I was getting, nausea, aura, and it was almost felt like I was having like a mini stroke every month. It was so bad. I would have word finding difficulties. And this was in combination with, my alopecia and Hashimoto's diagnoses. But I just assumed that since my family had a history of migraines, that this was just kind of my destiny.
There are multiple mechanisms with which there could be migraines. And one of the things you talked about, Merritt, was that with starting your periods. So there's definitely a hormonal component to migraines, and then you were getting them monthly. Christina is highlighting where there's mechanisms of disease states like POTS or dysautonomia. With POTS, there's really a lot of blood pressure and heart rate changes whenever you could just switch your position. And that in itself can trigger migraines on top of the additive effect of adding hormonal problems on top of it.
Yeah.
And then I'm hearing all the caffeine intake to actually deal with it. Caffeine daily consumptions can also trigger rebound migraines. So the remedies themselves can sometimes trigger additional migraines. So all this is what I call the shit show of headaches and migraines that most people that are headache sufferers live with. So there's autoimmune components, other disease states, there's gonna be a hormonal component, and there's a diet component. I'd love to know where you at, Merritt, 1 year out from our program, Christina, 3 years out from our program. Where are you at currently with your headaches?
I get maybe 1 or 2 a month, and they're no more than a 1 or 2 on the pain scale. A lot of times, as soon as I start to feel something creeping up, I can stop and say, okay, wait a minute, what's going on? And I can pinpoint what the issue is, whether it's I need to better control my blood sugar, maybe I didn't get enough sleep.
What about you?
Same story here. Not only do I not get those monthly migraines that are, hormone based, but like maybe 1 to 2 a month, and they're very tolerable. It usually means that I need to hydrate more, or that I've accidentally eaten something that I know I'm sensitive to, and I either have to just kind of suck it up and live with it for a little bit, and the pain's going to go away because I screwed up. But more often than not, it's really nice to be able to, like Christina said, I know the source of where it's not this random attack on me.
You two are already spilling the secret sauce. So we all want to know the secret sauce of what worked for you. So Christina, you started with, you already gave us a sneak peek. What worked?
The blood sugar, balancing the blood sugar was one huge component. Of course, with the gastroparesis, I had been prescribed a low-fat, low-fiber diet. I was eating way too many simple carbs.
Yep. But that's a typical diet recommended for irritable bowel syndrome, Crohn's, gut soothing diet, the Brett diet, gastroparesis diets, all simple carbs. What happened with that?
Well, I found out with the Foodmapping in particular that I was intolerant of gluten. I was intolerant of dairy. A handful of other things I was intolerant to that I was really surprised that I was eating pretty regularly. Blueberries, cranberries, mushrooms. Those were really surprising to me. And then a borderline intolerance to eggs.
Wait a minute. Blueberries, cranberries are really healthy for you.
Right. And so that was, I've been making smoothies, trying to get in some more nutrient-dense foods with the gastroparesis. And so trying to find ways to get in nutrition when I couldn't digest a lot of fiber. Making it into a smoothie made it, I thought a little bit easier to digest, but all those food intolerances were just causing more inflammation in my gut so that I couldn't absorb.
Christina, I mean, you bring up a really good point, because I think what brought you initially to working with us was a lot of these food issues with the gastroparesis. I mean, you weren't even necessarily looking to turn around your migraines or anything, POTS or anything else.
No, that was icing on the cake. I wasn't even worried about that.
You're a medical provider here. How was working with us with Foodmapping different than anything you've done as a patient or as a healthcare provider?
The thing that was really interesting was that to see that it was personalized to me. I had been trying, I had been recommended all these elimination diets that generally just left me crying because I felt like I couldn't eat anything. It was just eliminating even more foods. Other healthcare providers would just say, oh, just drink an Ensure. That'll just cover everything. But the thing that was really, and I also, everybody recommends, do this diet, autoimmune, you have to do this diet. And this was personalized to me. These were my personal results. Going through the program, I got to see other people's results. And that was really interesting to see that it wasn't, not everybody had to eliminate dairy.
Nope.
Some people, it wasn't a problem.
Right.
And so that gave me more confidence in the results of the testing, because a lot of other people try to say, oh, that testing isn't reliable. And this, I felt confident because you weren't just making the same across the board recommendations to everybody.
Oh, hell no. You know me, I'm like the epitome of personalized data. You gotta have personalized data.
Yeah.
I hate elimination diets that are personalized to no one. How quickly with Foodmapping and the results that you got changed some of your symptoms?
It took a little bit of time. I'm not going to lie, with getting rid of the foods that I was sensitive to, it took some time. The good thing is going through your program, you and your staff gave me guidance on things that I could do to balance my blood sugar while I was calming that inflammation down. So I was using things like collagen peptides and MCT oil to get good fats in, help balance that blood sugar. And I started feeling better immediately. during the course of your program, I also found out about some nutrient deficiencies like B12 that really helped me to start feeling better, since I was having trouble absorbing so many nutrients. It was probably a full 6 months. I mean, I was already reintroducing a lot of different foods before the end of the 2-month program.
Yeah.
But it was probably about a full 6 months before I was able to reintroduce fiber.
Okay.
But that was, I mean, I was already feeling better knowing that I had some tools to balance my blood sugar in the meantime.
So for me, what I'm hearing is getting accurate food sensitivity testing for you was a huge pivotal part of this for you, Christina.
Right, because it calmed down that inflammation in my gut so I could absorb nutrients from the foods I could eat.
So what I tell people is the gut sets the inflammatory tone for the rest of your body. So you got to work on that to figure out what's messing up that environment first. And food mapping, starting with food mapping is key. Merritt,
Right.
What was your journey around food? And it doesn't have to be food mapping where I mean, you have mentioned blood sugar in the past, but I'm wondering, how much do you think food was a role in your turnaround?
Well, it's interesting because I was already eating gluten-free.
Yeah.
And so then doing the individualized food mapping, I had tried, AIP type diets, and I had also even tried the, over the counter food sensitivity tests. And what I ended up with was this list of like 30 things I wasn't supposed to be eating. And so like Christina, I had this very limited diet. And so getting the specifics and specifically finding out, okay, dairy is like never going to come back into my world. But, I'm fine with blueberries and mushrooms, but cane sugar for me was screaming high. And so not only was it needing to eat differently, eating, higher diet and cruciferous veggies and, good nutrients, but also cutting the cane sugar.
And that's pretty specific because that's not all sugar. Cane sugar,
Right.
beet sugar, honey, all those are very different. I mean, it's very specifically for you as cane sugar, correct?
Correct. Because I can tell now that I've accidentally had something that had cane sugar in it because I will get a raging headache within an hour of having it.
Well, I love that, what I call additional data. When you reintroduce it after you eliminate it for 2 months, it actually gives you very clear indication that, God damn, that's really real.
Yeah, I did it accidentally with a can of what was supposed to be organic soup at work. And then all of a sudden felt like I was going to die. And once was enough.
But I love that you had data to drive that. You didn't have to guess and think, oh my God, all soup is bad. Is it this or that, or those 10, 20 things in that soup I got to avoid now again?
Right. No, it was the one ingredient that I missed.